I guess I'm going to introduce myself here. I'm Scott Thompson. I've been in practice here in Utah since about 2006, and I was trained in facial plastic surgery. And if you don't know what the difference is, facial plastic surgeons go through a whole different pathway to practice than a general plastic surgeon. Some of what we do is the same and overlap, but mostly my residency and fellowship was all focused on the head and neck and the face. So a lot of skin cancer, hearing problems, sinus problems, nasal problems, everything, and then also plastics as well. And this slide is making me look really old, but usually people tell me I don't look as old as I am, but this slide isn't doing me any favors. So anyway, I've been here in Utah since I finished my fellowship. I did all my training in New York, and it's been a great place to be. It's the practice has slowly grown over the years, and recently we added Dr. Henstrom to our practice, and it's been really great to have him as a partner, and he'll be speaking to us a little bit later. So this is my that wasn't my original staff. My original staff was Jenny right here, and Jenny and me, and that was it. And we've slowly grown, and now we have a lot of staff, and it's really fun. It's a fun office, and most of my Draper staff is here at the seminar today, so I appreciate them being here, and hopefully you'll have a chance to meet them as the evening goes along. We also have a couple, we actually have 3 nurse injectors that work in our practice that do a lot of injectables, Botox and fillers, which we'll touch on briefly, and they're great and very qualified and well trained. So we try to do a good job, try to provide comprehensive facial rejuvenation in our practice and other things as well, which we'll touch on a little bit. Maybe I'll briefly mention our mission statement. Our mission is what we want to be as a positive force in the lives of our patients. And our commitment is to treat you with genuine kindness and respect, and make appropriate recommendations that will help you to accomplish your individual goals, not what we think is important for you, and then provide safe and effective treatments to ensure the best possible outcome. So, some of the topics we're going to discuss right now are some facial rejuvenation topics: facelift surgery, max lift, fat injections, and skin resurfacing. And then Dr. Henstrom will be talking about some other facial rejuvenation topics. And all of these things here, and kind of our discussion tonight is going to be focused more on surgical interventions and more, I guess, invasive things like skin resurfacing, things that have a little bit of downtime. But I notice a lot of our audience tonight is young and probably isn't even thinking about facelift surgery right now. But the great thing about the way that aesthetics and cosmetic medicine has developed over the past few decades is that, you know, it used to be just skincare and surgery, and that was pretty much it. And now we have this whole array of different things that we can offer, and you can actually slow down the process so that the aging process, you know, none of us are trying to stop aging. We know that's an inevitable part of life, but if we can slow it down, it can really make a huge difference long term. So why do we need to talk about facial rejuvenation or think about facial rejuvenation? Really, our goal here is to restore youthful features. And so it's not to change how we look usually. It's not, there are people that do surgery that are, you know, trying to completely change how they look, but in general, that's not what we're doing. We're trying to restore features of our faces that age over time. And, you know, for example, yeah, I guess this won't really show up. But anyway, you can see this woman on the left. She's got jowling. She has a lot of aging facial features, and she's lost her jawline. She's lost some of the things that define her as a person and define her face. And so what we try to do is restore those things. And you know, I have people say, well, you know, I'm not interested in that. I want to age naturally, and that's fine, and that's great. But the bottom line is, when we interact with people every single day, from the moment we meet them, our eyes see certain things. We might make a judgment. This person seems like they're angry, or this person doesn't seem friendly. This person looks tired. And so the better we can present ourselves to those with whom we interact, the more successful we will be in our careers, the most successful we'll be in our social lives, and just in our general interactions with everyone else. So that's kind of what that slide is talking about. So aging is a process that happens over time, as we all know, and it's a combination of natural processes, just our own DNA and protoplasm, that's the genetic component, sun and environmental factors like smoking, nutrition, all those things contribute to aging. So let's just talk about some of the characteristics of aging. And the reason we want to talk about this is because then our therapies, or what we try to do to address these issues, are focused on those specific things. So we have textural changes or pigmentary changes to our skin. That's wrinkles, that's dark spots, it's all the things that we see on the surface. We have volume loss, and that's kind of more recently been understood and appreciated. It used to be lasers and facelifts, and that's all there was. But now we understand that we actually lose a lot of the fat in our face as we age. And so if we try to address aging facial features without thinking about that, then we're missing something that's very important. So that's the volume loss, the loss of fat. And then, of course, things just migrate downward as we age, and it's just part of the process, and it's what happens with age. And I have patients all the time come in and they're like, "Can't you just do this? I look so good when I do this." So that's what happens, is it just kind of descends gradually. So how do we address those three components of aging? For the soft tissue descent, we do surgical interventions to lift things back up. And there's a lot out there, and we even advertise this ourselves, a non-surgical facelift. And a non-surgical facelift is not really a facelift. We can do things to kind of make it look like there is a facelift, but really the bottom line is, in order to correct the soft tissue descent, you have to get in there and lift it up and move it back to its original position. Volume loss, we use fat grafting, we use injections. You're probably familiar with Juvederm and Restylane and those sorts of things. Those are all intended to address this volume loss situation. And then there are skin changes, and for those, there are lots of different things, but they all somehow resurface the skin, or they kind of turn the skin over. The Botox, for example, injections, those address lines and wrinkles, and sometimes we use fillers for that as well.